Assalamu alaikum, everyone, and welcome to a new session from MAP Health and Wellness Committee. I'm Asma Shoaib, the chair of MAP Health and Wellness Committee. I hope you all are staying safe, still positive, inshallah. And since we have some good news, we are already in the phase one of the governor's plan for the reopening of Northern Virginia. And everything, if everything stays same, inshallah, we will be entering phase two this Friday. And inshallah, a lot of things that we were missing out, we will be able to do that. But what does it mean? How do we can make ourselves and our others safe once we are entering the phase two, or even in phase one? Like how can we become? How can we be safe? How can we prevent the spread? And what does it mean? Has the curve flattened? Does it mean that the numbers are reducing? The numbers are still going high? For all these questions, Dr. Tarannum Latif is joining me. She's an epidemiologist and a very active member of our community. She will shed some light on how we can be more active and protect ourselves. So Dr. Tara.
All right. Assalamu alaikum, everyone. Thank you so much, Dr. Shoaib, for your introduction. And so, my goal this evening is just to give sort of a snapshot of where we are in terms of the pandemic. And I think it's important to recognize the pandemic is not over. What were the goals of going into lockdown? Have we achieved that goal? Where are we right now, and what can we expect going forward? So just to sort of remind everyone, the purpose of going into the lockdown or the stay-at-home orders was to flatten the curve and spread out the cases so that the hospitals would be able to manage to deliver healthcare efficiently. The goal of going into lockdown was never to eradicate the virus. So we have to remember that just because the lockdown has ended and we're reopening, have not eradicated the virus, right? The virus is still very much here. What it means is that now if we do contract the virus, that if we get the virus, we fall sick and we go to a hospital, we can have an expectation that there are enough physicians to care for us. The physicians have, sufficient protective equipment. There's enough room in the ICU. If we should need an ICU admission, there are enough ventilators. If, God forbid, we should need to be on a ventilator. So there's enough resources now that it can serve the number of people who have the disease. But the virus is still here, and we have to remember that. So what we've been looking at for reopening is some metrics. And what are those? That is, what percentage of people are hospitalized every day? How many people are dying of the virus every day? And what is the percent of tests that we are getting that's positive? And this is all, alhamdulillah, has been heading in a very good direction. And when we say very good direction, we mean stable or trending down. We do not mean we are at zero, right? So in phase two, just to remind everyone, we still need all our vulnerable individuals to shelter in place, meaning the elderly, those who have chronic health conditions, particularly affecting the heart or lungs, autoimmune diseases, anything where getting a serious infection could cause significant harm and could cause you, to have a pneumonia that takes you to the ICU. So we still need all of those vulnerable individuals to shelter in place. Now, when you go out in public areas like parks, outdoor recreation, shopping, you should still maximize the physical distance from others. If you are in a social setting of more than 50 people, you should have appropriate distancing, and really should be avoided unless you have all precautionary measures. In phase two, it is said that non-essential travel can resume. So again, non-essential travel has to be weighed against the risks and benefits of the individual traveler. So it doesn't mean suddenly in phase two that everybody can travel and they are safe, right? So it means that it is okay to travel if you really have to, provided you observe all of the precautions. And for employers, again, they are supposed to continue to encourage telework. So if you are working for someone else and your employer tells you everything's fine, you can come back to work, you really should refer them to the CDC guidelines and explain that that is not the case. And if your employer, you do go back, there are common areas, those all have to be subject to the new guidelines, which is, the cleaning, the ability to enforce social distancing. So, and the other big thing, as you guys know who have children, is that in phase two, the schools are allowed to open provided they meet all the requirements. And in phase 2, really, it's going to be the pre-K through 3rd grade, the special educational folks, children, and the English language learners, because it's very hard to meet the needs of these students via e-learning or via computer-based learning. And even when the schools, right, it's important to know that if you do send your child back to school in fall, that the school is observing all of the guidelines that they need to observe. So just the bottom line, it's is that the purpose for which the lockdown was intended has been fulfilled, which is the curve is flat, our cases are flattening. But we are not near the end of this at all. So we still have to be very, very careful. And depending on how careful we are in each phase, we have a better chance of going to the next phase. So I think a word of caution and sort of a moment of celebration together. By doing what we did and by making sacrifices, and I know for our community during Ramadan to not go to the mosque was a very big sacrifice to make. A very big spiritual sacrifice, but we did it. We were called upon to do it, and alhamdulillah, Allah has rewarded us for doing the right thing. We are heading in the right direction, but we're not at our final destination. So I think that's about what I have to say. Asma, if you want to open up to questions, or if you have any questions, I'm happy to answer them.
So Dr. Tara, just a quick thing, since the masjid, all the masjids have started to open and people really want to go out and pray the Jummah prayers and the five daily prayers, what advice would you give our Muslim community?
So I think exactly what I was saying about you have to do your individual risk evaluation. So, as you know, one of the first states you might know to open restrictions and sort of open without having this gradual phased approach was Texas. And a lot of them have now had, like, churches had to close down because there were so many cases. So just because something is permissible does not mean something is desirable, right? For you. So if you're young and if you're healthy, then yes, it makes sense that you would go, you would do your physical distancing, and you would attend the mosque. But if you're not, then to me, it doesn't make sense just because the mosque is open, you go. You have to evaluate your own risk profile, who's living at home, right? And so let's say you are a young, healthy person and you do want to go to the mosque, I think you can. But perhaps when you go home, then immediately you might want to change clothes and shower before you go and sit down with your elderly parents or your grandparents. So that part of the risk has not changed. So while it's okay for you to go to the mosque, I think you still have to look at your individual risk factors and the risk factors of people you are living with and you're interacting with on an everyday basis.
That is great. Thank you so much, Dr. Tara, as this is always like, whenever I talk to you, whenever you join us, it's always very beneficial information. I hope our community follow these guidelines and they stay safe. So inshallah, we all can move towards phase 3 and soon back to be normal life, inshallah. Thank you so much, Dr. Tara.
Yes, inshallah, praying for this. Yes.
Thank you so much. Thanks. So thank you so much, Dr. Tara. Next, I have joining me Tabassum Rahman. She is a clinical social worker, and she has some tips and techniques on how we can control our anger, control our emotions. I'm sure everyone who has been staying home and staying away from the normal life has a lot of anxieties and a lot of stress. And she will tell us how we can help ourselves and be a better person. So Tabassum, Assalamu alaikum. Hello.
Social worker, and I'm here. Can everybody hear me?
Yes, we do now.
Wonderful. I'm Tabassum Rahman. I'm a licensed clinical social worker. I have been a part-time counselor family counselor at Darul Noor for the last 7 years. So we definitely can come in, and if you need to talk about anything, you can arrange it through Taliba Hassan. And today I wanted to talk about controlling anger before it controls you. It's been hot. We've been suffocated. Everybody's been at home. So I have some really good tips and techniques for taking charge. So I just wanted to say, what is anger? Let's go ahead and talk about anger. Anger really actually isn't a primary emotion. It's a secondary emotion. Anger really is only felt after the primary emotion is experienced. Sometimes we just go straight to the anger. but sometimes what's behind the anger, it could be fear, offense, hurt, humiliation, rejection, pressure, sadness, even happiness. So when does anger really happen? When does anger occur? Well, we tend to get angry when something important to us is threatened or challenged. We get angry when we're about to lose something we value. We get angry when something we value may be kept away from us, or we might be feeling like it's going to be kept away from us. So what angers one person may have no effect on another because we value different things. And sometimes what makes us angry at one time may not make us angry at the other time, because maybe at that time we are not placing that much value on whatever is at stake. And there's an anger cycle. So basically, you kind of feel this threat. And when you feel this threat, there's a primary emotion that comes up, either the fear or the unhappiness or the sadness or the frustration. Then we get what's known as anger. And then after that, we express it. Everybody's expression of anger is different. Some people go quiet, some people tend to scream, some people feel hot all over, some people just shut down. And then after that, the expression of anger, there's a shutdown period where we kind of come off of that expression of anger. So why control your anger, right? I mean, anger is normal and it happens. And why should we control it? Well, there's a couple of different reasons why. Because when we get angry, our clear mind seems to get clouded. And when people fly into a rage, there's always a bad landing. It's never a good thing. Sir St. Francis de Sales said, there was never an angry man that thought his anger is unjust. When we're angry, we tend to think everything we're thinking is right. I mean, the Seneca always used to say the greatest remedy for anger is delay. Like, just go ahead and delay it. Ralph Waldo Emerson was quoted as saying, for every minute you remain angry, you give up 60 seconds of peace of mind. So, and sometimes, when you're angry, you tend to say things that you regret. If you have kids or other people around you, you kind of teach them that it's okay to act in this way. So it is really important for us to learn how to control that anger. Now, first thing to control anything is to identify what it is and where it is. So identify your anger. What physical challenges do you have? Do you feel like, somebody's neck gets angry, or you feel like your heartbeat goes fast? And keep an anger diary. Throughout the week, write the times like when you tend to get angry. What is happening? When is it happening? And try to discover the feeling why. Were you angry because you were upset? Were you angry because you were sad? Were you angry because you thought something was going to be taken away from you? That's a good way to, identify your anger. And then how to diffuse it. Well, I have some really good practical solutions. When you feel like you're getting angry, count to 10, 20, or 30. That really helps to diffuse the anger. Take some deep breaths, just breathing in deeply, breathing out deeply. Work it off. If you can, color, paint, shovel, clean, exercise, lie down, go to sleep, go make wudu, go pray some salah, pray some Quran, do anything that works for you to kind of dissipate that anger. You can call someone, there's probably somebody that you can just vent to. A lot of workplaces have employee assistance programs, EAP, that you can just call and talk to a counselor free of charge and just kind of vent out, get your frustrations out. You can write a letter, you can journal, you can practice self-care, go do something that makes you feel good for yourself. Take a walk, take a bike ride, or, even do your nails or any other type of grooming thing that you can, or bake, and respect others' rights and feelings. And then try to express yourself using I statements. When you get angry, you're trying to blame other people, like you did this, so I got angry. But instead, you should say, well, I was feeling sad, so I got angry. Focus on your own behaviors. And then step one, you just have to ask, what are you afraid of? What feelings preceded the anger? What other feelings are you feeling? What are you trying to control? And then ask yourself, what can I control? If you got a flat tire, can you control what you can do? You just have to say, okay, I'm really angry because now I'm late, and that makes me frustrated because I was always late anyways to begin with. But then you have to move on. You have 3 behavior choices. You can either be aggressive, passive aggressive, or assertive. And step 2, consider your options, make a list. You have a flat tire, what are you going to do? There's no point in getting angry. You have to go ahead and make a list of what you want to do next. Choose the option that will bring you happiness in the long term. Do you call and cancel that appointment and just reschedule, and that way you don't have to be worried about it? Or do you quickly try to get your tire change so you can make that appointment? In any given situation, we have a lot of different options. And then just choose the option that will bring you happiness in the long term. Be cognizant also, if you have little people around you or even older people around you, of, the example that you're setting for the people around you. So I know I just went over anger in a little bit. Everybody deals with it differently, but these are some practical solutions and reasons of how we can attack this issue from an open and honest communicative way. I am also open if you guys want to talk about any other things, stress management, mindfulness, work-life balance. I know Taliba will talk about mindfulness and lead us through an exercise later. Anything else that you'd like to see the Wellness Committee focus on, please do write in or Facebook us or send us any messages. You can email, and then we can, inshallah, do whatever will best help serve you and your needs. We're here for you. Any questions? Anybody in the moment?
Thank you so much, Tabassum. Let me see if I have any questions in my comment box. The only question that I have in my group is that, Tabassum, what is the difference between anger and anxiety?
That is a really good
Are they the
question.
same emotions?
Yes. So they are different emotions, but they are interrelated. Sometimes anxiety is when we are feeling a lot of emotions that we are not having control of. We feel like they can't manage. We feel like life is out of our control, and that brings on anxiety. So anger can bring anxiety, as can other things like depression and sadness. So there is a big difference. So that's why it's good to manage our anger so we don't become anxious, if that makes any sense.
Okay. And at the moment that we realize that we are getting angry, the same technique that we use one time should work every time? This is another question for you, Tabassum.
So sometimes the same technique would work, but sometimes different techniques work. Sometimes deep breathing may work for you. Sometimes painting may work for you. Sometimes it's where we are. If you're getting angry in a meeting, you might have to do a little bit differently. You may not be able to leave the meeting. You might still have to participate. So at that time, it might be helpful to count to 10 or 20 or 30 or do deep breathing, something that you can do in the moment. Whereas sometimes if you're getting angry and you're at home, then you have the ability to go make wudu, go pray. Maybe you have enough time that you can go watch a TV show. Maybe you can do some painting or you can do some yard work. So different things could work at different times. And then different things are preferable for different people. Sometimes people tend to get quiet and they don't want to talk to anybody when they're angry. So they might do things that are a little bit more solitary, versus extroverts like me. Oh my gosh, if I'm frustrated, I need to talk to 3 people and just really vent it out. So different techniques will work for different people and also at different times.
Thank you so much. Everyone, if you still have any questions, you can leave it in a comment box and inshallah, we'll make sure that it's get answered. You can also email us at health-wellness@darulnoor.org. So I will be passing the screen over to Sister Talba Hassan. She's the Vice President of Muslim Association of Virginia. She's a very active team member, and inshallah, she will go over some announcements like what our social services committee is being busy with, and also some techniques and exercises on mindfulness. So Sister Talba Hassan, Assalamu alaikum.
Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Brothers and sisters, just a quick announcement today that now we're going to have 4 prayers on Friday. They're going to be outside. You will have to bring your prayer rug, and please go to www.darulnoor.org and register. And basically you are signing off agreeing that you're coming on your own free will, and you're not holding the Muslim Association of Virginia responsible if you think you got sick from the masjid. The prayers are going to be at 12:30. I'm sorry, 12 noon, 1 o'clock, 2 o'clock, 3 o'clock. So please register. Please bring your own prayer rug. Please come in wudu. The building will be closed. It's going to be outside. If the nature decides to rain, then that prayer is canceled. So we'll be outside behind the masjid in that flat grassy area. All right. And this is for ages 15 to 65. All right. Please, if you're sneezing, if you don't
Sister Talba, we don't hear you anymore. I think either you lost a connection or something. So what Sister Talba was going over is there some rules and regulations of visiting the mosque if you're deciding to come and for the Jummah prayer. If you are age less than 15 years old or more than 65, please stay home. It's for all your own safety and it's for safety of everyone. Also, if you're sneezing, if you have cough, if you think you have any symptoms that is kind of unusual for you, please stay home. And as she mentioned that the prayer will be outside on the grassy area, the buildings itself is closed. So please remember to bring a prayer mat. You have to wear a mask to enter the grounds, and inshallah keep the distance, the 6 feet distance at all the time. So I think I have lost Sister Talba Hassan. She had to go over some techniques on the mindfulness. Unfortunately, I think the weather is very bad where I am. I'm sure like it was pouring where she was too, and she lost us. So we will be stopping our presentation right now, inshallah. I hope you all stay safe, stay positive, and we hope to see you again in 15 days, same time. Assalamu alaikum, everyone.